At Arkansas Children's, our mission is to champion children by making them better today and healthier tomorrow. And I love being part of that mission. My work as a public health practitioner is really focused on helping keep kids healthy and safe in their homes and communities. And our mission statement really brings that to life every day. The Child Advocacy and Public Health Division at Arkansas Children's helps to improve kids' health, helping to bridge gaps in access to care for kids by helping to address social determinants of health like food insecurity or parenting supports in our communities across Arkansas, by implementing public health programs in all 75 counties in our state, and by helping to change the system where it needs to change in order to improve kids' well-being.
What I enjoy most at Arkansas Children's Hospital is taking care of the kids to the best of our ability. We collaborate with other teams to make sure that in clinic and outside of clinic, as best as we can do, we can help them financially, with education, with food insecurities, legal issues, anything like that, which is hard to do just when you're focusing on something medical. We can do it more outside of the area. So when the screener was first implemented, it was about 2 years ago, and we were the pilot program within this clinic to do it. And it asked for education, food, and housing insecurities in the beginning. And MLP worked with frontline staff to make it user-friendly for nurses and for the patients' families. And so it has progressed over time, and we have collaborated with multiple groups to do housing insecurity, education insecurity, literacy for the families, anything like that to help them once they leave our clinic.
We love to engage with partners, so much of the work we do is really grounded in partnerships. We can't change kids' health alone. Only about 20% of the factors that determine a child's overall health outcomes actually happens within the walls of a clinic. So we are really working with partners, working with schools and communities to help address those things that are impacting kids' well-being.
Some people call it work. I call it a mission, a privilege, to help those who need a little help. The ones who have children and the mothers lose their jobs because the children are in the hospital, and usually they have a low-paying job anyway. We're able to furnish them with food, also a little love. I love giving that grandmotherly love. We have so many needs in this area, not only Pulaski County, but outlying counties. The children that are seen at Children's Hospital, the parents walk out and tell me they have no support in their county. So we're able to give them something to hold on to.
The medical legal partnership is very unique and special in that it is a team of doctors, social workers, attorneys, nurses, all coming together to make sure that children of whatever age are having their healthcare needs being met outside of the hospital as well as in it. So they are making sure that where they live, learn, and play is all going to be contributing to their overall well-being, not just about the actual physical medical care that they're receiving. At Legal Aid of Arkansas and the medical legal partnership that we have with the Arkansas Children's Hospital, we represent the lower income patients and the families of those patients at Arkansas Children's. We now are aware of what are the more common social needs that aren't being met for our children, whether it is food insecurity or it is the quality of the housing that they're receiving. Sometimes there might be domestic issues in the home that the family is seeking help with as well. A variety of issues, really.
Yetzabeth nació con el síndrome de Down.
She said that she was born with syndrome of Down and learning disabilities, but with the therapies she's receiving here in Grove, she can see the improvement for the good care she's receiving here. She is very grateful for the help that she received from lawyer Taylor, who was the first person she got in contact with. He did a great job. He was very persistent on her case to the point that him and the team, and they won the case, and She just so grateful. And just as him, she thinks that the whole medical legal department does a wonderful job, and she's very grateful for it.
A child's zip code often tells us more about his or her health than what is in their medical chart. That being said, it is our future to really think about building the resources at the community level, about building the right kind of partners that in a child's home and community and school to help that child thrive when they go home from the hospital.
So one of the things that is so great for our staff, MLP brings back statistics for the last year of what we've done and stories of how we've helped families. And as a nurse, it impacts us because we see that we finally are being able to help them as much as we can.